Hi, my name's John Bosworth. I'm a licensed mental health counselor in private practice in St. Pete, Florida. I'd like to talk a little bit about the psychological benefits of plastic surgery. Plastic surgery, especially in our day and age, seems to be becoming very, very big business. A lot of billboards with liposuction and cosmetic surgery, augmentation. A lot of different procedures are available. From a psychological perspective, what I like to look at and what's interesting to me is what really makes a person on the cosmetic side tend to engage in plastic surgery. Some of the obvious ones from a medical perspective might be skin cancer. Some people have a skin cancer removed on their face, usually on another part of their body. They may not have any plastic surgery done, but on the face, they tend to maybe want the scar smaller, or the spot that was removed to look like it was before the actual removal of the cancer. The benefit of that can be that the person's face, and maybe they might have been burned also. Let's use a burn victim. If they're burned, sometimes the plastic surgery can actually restore a sense of peace to them, as far as trying to get them back to what they look like, and so they're a little bit more comfortable with their appearance. But I like to, from a psychological standpoint, work with somebody before they get the plastic surgery and really try to work with them on what we call, in rational emotive behavior therapy, unconditional self-acceptance. And what that means is whether or not you've got a spot on your face, or whether or not your proportions are not exactly like a Barbie doll or whatever, can we try to work first on really accepting that there's differences and that you're human and fallible, and that some type of some type of augmentation or cosmetic or plastic surgery might make you look better, but it might not necessarily make you feel better unless you also work at unconditionally accepting yourself with or without the surgery. So what I try to do with clients, or talking to the public in general, is to get them to recognize that unconditional self-acceptance is a better way to go. And then if there's some type of cosmetic surgery that needs to be done on top of that, then you can look at that after a certain type of self-acceptance is implemented. My name's John Bosworth, and we're talking about the psychological benefits of plastic surgery.